Aló y buen día. My name is Gabriela Coronel. I am a 2017 graduate of ETSU's College of Public Health, and I'm currently a Peace Corps volunteer in the beautiful country of Ecuador in South America. Primero, let me start with the famous disclaimer of each and every Peace Corps volunteer. My experience in service is unique. No two volunteers in the same country, continent, sector, or job have the same experience. However, I encourage you to seek out those different perspectives. Here's a little background on what I'm currently working on as a community health volunteer. My site is Tenguel in the provincia of Guayas. It is a small rural town of about 12,000 people, although most days it feels more like 1,200. While doing my community assessment after I first arrived at site, I found that there was a lot of misconceptions about HIV and AIDS, as well as a very high incidence of young teenage pregnancy of girls between the ages of 13 and 18. Therefore, my two main goals, working with my local counterpart, an obstetrician at the local Ministry of Public Health Center, are in HIV prevention and promotion of voluntary testing and adolescent sexual and reproductive health education. Some of my day-to-day work includes going to schools and giving a series of comprehensive sex ed classes, heading out into the haciendas to educate workers on the myths and truths of HIV and offer voluntary testing, or planning a World AIDS Day march to promote the destigmatization of those living with HIV in my community. One of the main Peace Corps goals in our work is sustainability and capacity building. So in my work, that involves training my local health promoters in the dynamic and interactive programs like Grassroots Soccer, a program for adolescents that teaches HIV prevention, as well as involves some gender equality and consent activities, so that they can continue working in these areas even after I am gone. After a year of working in these areas with my counterparts, I finally feel comfortable enough to let them continue the work on their own while I begin looking more towards other projects in maternal and child health, especially in regards to nutrition, as well as gender equality in conjunction with sexual and reproductive health. I'm excited to see what kind of projects my counterpart and I come up with for the next year. I would like to add here, though, that Peace Corps also has two other main goals for all of their host countries: representing and showing U.S. culture to the host country, in this case Ecuadorians, and also learning and experiencing the Ecuadorian culture in order to share it with other friends, family, everyone else back home. This has honestly been my favorite and most thoroughly developed goals in my service. My impact so far in my community has been, from what I've gathered, more on an individual level as a role model and mentor to adolescent girls, such as my host niece and her friends, as well as an interesting counterexample to those who may have never had an actual conversation with someone from the U.S. and only think it consists of Miami, New York, and California. I love sharing my experiences at ETSU, the remote access clinics, working at the Atlanta Harm Reduction Center for Alternative Spring Break, participating in Service Saturdays, and telling all of my friends here in my community about how diverse the U.S. truly is. This experience is learning both ways, because while Ecuador faces some challenging public health issues, they are also very advanced in other areas. They have an obligatory rural year for all medical students, in which they must practice a year in a rural area medical clinic in order to be able to practice as doctors or nurses or orthodontists or obstetricians before they are licensed. The Ministry of Public Health is open to all people, even foreigners, for free, with or without insurance. There are also free condom dispensers in all of the health centers, which are accessible 24/7. There have definitely been some incredible efforts in public health, but just as in the U.S., we still have a long way to go in both countries. Now, you may be asking yourself, why Peace Corps? Can I make a commitment to move to a different country, learn and speak a different language, and immerse myself in a different culture for 27 months? Well, I can definitely tell you it's not easy, glamorous, or anywhere near what you expect. However, it is an opportunity to live outside your comfort zone, build resiliency, learn and work in global health and development in all its complexities, and really challenge your own worldview. Peace Corps is not for everyone, but at the end of the day, I wouldn't take back a single hard day or bad experience because the good days and unforgettable relationships I've built in my community will last a lifetime. I'm currently in month 17 and I have 10 months left before I close service. Recently, I took the GRE and am applying to MPH programs. As a returned Peace Corps volunteer, there are a number of different universities that offer Coverdell fellowships exclusively available to our PCVs. I'm looking to capitalize on that and get an MPH in Health Service Administration and Policy and possibly a dual degree with an MA in Latin American Studies. I hope to be able to work on a policy level to increase access and quality of care to marginalized populations in the U.S. Being in the Peace Corps has taught me so much about the interculturality of health on different levels, and I hope to go back and make strides in those health disparities. I would like to take a moment and thank all of ETSU College of Public Health staff and faculty for preparing me as well as possible for my Peace Corps service. There isn't a class I haven't used or a professor that I haven't silently thanked for helping me make sense of my Peace Corps work and the goals of global public health. Gracias y que viva Tenguel!